Welcome, 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 everyone, to Black Men's Health. We're so glad that you are joining us today because we have a very vital and important discussion that touches on some key issues in the Black community. We are having a discussion today about Black people, public health, and tobacco use. And our special guest this evening is Mr. Ladarius Gamage. Now, before we get started, I'm going to jump right in and tell you a little bit about our guest, and we'll get right into it. All right. Ladarius is currently pursuing his doctorate in public health at Florida A&M University. Let me rephrase that. Ladarius is currently pursuing his doctorate in public health at the Florida A&M University. He obtained his master's in public health from FAMU back in 2016 as well. Mr. Gamage serves as a member for youth and is a youth engagement specialist that provides skills building workshops to help develop and prepare the leaders of tomorrow in his community. Professionally, Ladarius currently presides as the statewide health equity and special projects coordinator for the Bureau of Tobacco-Free Florida. He recently transitioned from being the statewide youth advocacy coordinator at the Florida Department of Health for students working against tobacco as the statewide program manager for SWAT. Every day, Ladarius worked with talented youth and excellent local county coordinators to decrease the inhaled nicotine rate of youth within the state of Florida. In his current programmatic role at DOH, Ladarius has served or continues to serve the state of Florida on many community health initiatives and projects. Ultimately, he wishes to reduce health disparities and increase the promotion of health equity. We are pleased this evening to have Mr. Ladarius Gamage with us today.
What's up, brother? How you doing?
I'm doing all right, man. I'm just super excited. I'm super happy to be here. Thank you so much for that beautiful introduction. Man, thank you for having me here.
That's all you. We thank you for being here, man. Thank you for your time and attention.
Yes, sir.
Absolutely. And when we start these things, we love to get to know a little bit about our guests, to let people know about them a little bit. So we had to start with these icebreaker questions. The first thing I want to ask you is, did you play football in high school? And if you did, because I think you did based on my research, what was your most memorable moment from those times?
Yes, I did play football in high school. I played at Leon High School for 3 years, but then I transferred over to FAMU High.
Okay, a baby rattler. Okay.
Yeah, so I'm a full-blooded rattler. I'm like a full-grown rattler. Like I played middle linebacker when I got over to FAMU High. My favorite football player all time is Ray Lewis. I have a picture. I'm staring at him right now on the side of his wall. So, you know, my favorite times during a football game were goal line stands. And I had quite a few. You know, there's a couple games I can remember where, you know, it was like an inch to the goal line, but, you know, I stopped them. And like what I loved about those moments where it was a battle of inches and I won, you know?
That means you like contact, conflict, and collision. Welcome it. Welcome it.
It just honestly, to me, I'm a competitive person. You know, like, you know how they say, some people say, I don't like to take no for an answer. Like I'm really one of those people, like, you know, like, I guess the best word I would say to sum myself up is resourceful, because or resilient, because I really try to find a way to get things done. You know, I don't like to leave it as, no, let's not attempt that. Like, if there's a way that we can get close to the target, like, I want to find that way, you know?
I like it. I like it. I like at times when folks are telling you no, or saying it can't be done. That's what they believe, right? That has nothing to do with my mindset and my setup and my atmosphere, right? Yeah, maybe you can't get it done, but I on the other hand, maybe I might be able to get it done. So let me try.
I might be the man for the job. You never know.
I might be the man for the job. That's right.
That's excellent. Did you do the Ray Lewis dance when you come out
Yeah.
for games?
Oh, man, listen.
Takuma, I promise you I was about to ask you that. Do you have a dance down?
I never did it before the games, but guess what? The last time he won a Super Bowl, I did it. And what did he end it on? A goal line stand.
Yeah.
So, I did I did it, man. So yes.
Nice.
He's got some energy. He's got some energy behind that talent for sure. Yeah.
Absolutely. And so I wanted to ask you, like, you came up, you're a pure-blooded Rattler. Can you talk a little bit about your youth and childhood and kind of the environment you grew up in and how that impacted you?
Yeah, I grew up in a special way. I think I like to think that I'm quite fortunate. I actually, part of my childhood, I actually grew up in a house where there was 3 generations in it. I would like to say, I was at one point I was staying in the house with my great grandmother, my grandmother, and my mother. And and I'm a very blessed young man. Like I got to grow up and see my great great grandmothers still around. So all that generational knowledge and stuff like that. But grew up in a single parent household for a good part of my life, and just watching my mom work. And I'll never forget this conversation my mom gave to me when I was 8 years old. My mom came home from work one day. It was late at night. It was probably like 8:30, and she said to me, "Son, it's me and you against the world." And she might not remember that conversation, but I remember that conversation. I even remember what I was eating that night. And it really touched me, and it really touched me that my mom will come home from work and be tired, and I'll be doing my homework. I'll be studying my social studies. I'll be studying my mathematics. I'll be studying science. And my mom would come home and make sure before she went to bed, she would quiz me on what I learned in social studies. She would quiz me on what I learned in math. She would quiz me on what she learned or what I learned in science. So, throughout my upbringing, my mom was my tester. She was she was my sharpener, that some people would say. She was the person that kept pushing me. And, and whenever I didn't, get, I want to say acceptance into some program or club or whatnot, my mom always told me this one line. She said, "Show them what they're missing." My mom always told me that, show them what they're missing. She said, "Don't get mad, just show them what they're missing." And so even to this day, I use that phrase to keep a positive attitude and to keep, pushing onward and upward and show people what they're missing.
Sounds like an amazing woman.
Yeah, I talk about her all the time. She's like, "Will you stop talking about me?" Like, Mom.
That's a blessing. The gift that keeps on giving. And to have, like you said, to have a grandmother and a great grandmother in the house, that's a blessing to have that village around you. Everybody's not as fortunate, so that is a blessing.
Mm-hmm.
Just being able to soak up all that knowledge there, it's such a blessing and a privilege.
If you pay attention, right, Takuma? If you pay attention.
If you pay attention.
Sometimes as youth, we don't realize what we have there until later, right? So, we just pray that we're paying attention to all of that when we have it in front of us.
Absolutely.
Yeah. And you touched on your subjects and the homework you do. Were there do you have favorite subjects in high school or even middle school? And how did your intellectual interests begin to take shape?
I would say that growing up, my favorite subjects were history, science, and math. My father, it's just like, my father instilled inside of me, he said, "Son, a Black man should always know his math. He needs that." So I pushed myself to learn math. Science, I just, I had a fascination with things and how they worked. So that just came to me naturally. But history was probably my favorite subject out of all, because it's like, if you knew history, you knew how to avoid mistakes. So, You know, at one point I thought I was gonna be a historian. So like, really it took me a minute to really sit down and figure out what I wanted to be in life. I just enjoy school. That's why I'm getting a doctorate, I guess.
And public health, that's such a critical area of study as well, that is gaining more exposure now in light of the fact that we're in the middle of a pandemic and we have all these different events, these medical events that are significant that are happening across the world. So, what made you want to pursue that area of study?
You know, that's a good question, Takuma. Um, I think a problem that we have now, and I'm speaking because I am a young man, I'm 31 years old. A problem that we have right now, especially when people are trying to figure out careers, is we don't sit down to take the time to try different things. You know, I think that one problem that we have as young people is that we sometimes we lose courage and we accept conformity. And and that's a problem because if you always accept conformity, you'll never know who you are and you'll never know what you're really good at. But when you have the courage to take a step forward, um, then you'll figure out who you are and what your talents are best suited at. And I say that to segue into the conversation of how I found myself in public health. I went to school, got my undergraduate in healthcare management. So of course, I wanted to get into healthcare administration. That's what seemed logical. I have my family; they're all involved in healthcare. My mother is a medical lab manager now. She's been a medical lab tech, phlebotomist for so many years, but now she's a medical lab manager, and she's going to be a medical over a coordinator over a hospital at one point. I speak that into existence. But they told me to go into the medical field, so I did what they said. And then when I got my bachelor's, just like many African American graduates or many graduates, period, it was hard for me to find a job because the field that I got my degree in wasn't specialized. It was a generalized degree, healthcare management. So I sat around for a minute. I got a job, a good job, a good paying job, but I didn't like it, and I left it. And I remember I was sitting down one day and I was thinking about my life. And then my mom came to me and she said, "Son, you need to go get your master's." She said, "I know you. You're someone who likes to learn. You're someone who likes to be the best. You're someone who likes to do so many things. And you'll never be satisfied until you get your education." I listened to a couple of different mentors. And one of my mentors, he's in the United States Public Health Service Corps. And he told me, he said, "Son, go ahead and go into public health. They got all the money there, the scholarships over there, whole 9 yards." He said, "That's a whole career." I went and applied for it, and like the Red Sea, everything opened up. I got into the program. When I went in there my first semester, I was literally sitting in class like, what am I doing here? Because I was so interested in pursuing and working in a hospital. That's why I always thought I wanted to do. And people had taught me, had said to me and spoke over me like, "Ladarius, you have the type of mind that'll be good at figuring out problems and systems, like, resolving issues and things of that nature." They were right. But where they told me to use my mind at was wrong. When I sat still in that public health program that first semester, I learned so many fascinating things. And I guess my affinity for science came back to me, and I knew I was meant to be there. After that semester, I had got a scholarship. I kept, studying, kept doing well in that program, and I ended up getting an internship here, which ended up turning into a job at the Florida Department of Health in the Bureau of Tobacco, Florida. I did my work on my special project for my master's project on hookah and e-cigarette usage with college students and young adults, and it turned out to be amazing. And people remembered me, and they gave me a job, and I mean, it turned into a bigger opportunity. And I feel like public health called me. When I got into that classroom, I started to learn about all the different issues surrounding public health. I said, "Man, I didn't know this before," and I felt like I had an obligation to inform people. And because I felt as though I had an obligation to inform people about the issues that were going on that many people didn't know, that's why I feel like I'm sitting here today.
And that word courage is important, right? Because even when those opportunities, it sounds like, when you immerse yourself, all these opportunities expose themselves, right? But even, being able to take on those opportunities and go in a different direction that maybe you were, kind of locked in from previous advisors, previous mentors, previous guidance, and people that were really pouring into your life, they might have had you going along that direction. Speaking about conformity, it's easy enough to kind of go with the flow, especially if you're comfortable. So I'm glad you had that courage to, branch off and do some other things that were presented to you. Sounds like a blessing.
Thank you, sir.
And we've heard you speak before also, so we know you can be a blessing to others. We know you can be a blessing to others also as you continue your work.
Thank you, sir.
Yeah. So tell us, man. If somebody asked you off the streets, what do you do? What do you do today? What would you say? How do you explain it?
I would say I live to make an impact, and the reason why I say that is because that's what your life is meant to do. Your life is meant to make an impact. It's meant to help others and make a difference in this world. Some people say, hey, I do this for a living, I do that for a living. No, wherever I am placed, I am going to do my best to make a difference.
Amen. Amen. So tell us about the work that you're doing today at the Department of Health.
So at the Florida Department of Health, as Takuma just mentioned, I just recently transferred over to being the statewide youth advocacy coordinator. It's kind of bittersweet. I'm still in the Bureau of Tobacco for Florida, but it's kind of bittersweet because I got to leave it behind. I used to love everything I did with SWAT, working with the youth. They called me the hype man, being the motivator that I was, getting the troops all rallied up, but also getting the coordinators rallied up. But now I'm switching lanes and I'm trying to get some different troops rallied up for a different cause. Now I'm working in health equity and special projects. But what's so funny is the projects that I worked on in SWAT kind of set me up for this. When COVID first hit, I was asked to be a part of a youth and young adult COVID initiative that we created here at the Florida Department of Health. And it received national recognition. A couple of different states tried to model it. And it kind of set me up for this position. Now I'm working with Cessation Access, trying to make sure that we promote cessation services to priority populations. Some of those priority populations include the African-American community and other different communities. But really, we're trying to see a decrease in the numbers of tobacco usage around the state of Florida. I also work with the Tobacco Free Moms and Babies Collaborative. And that collaborative is to try to engage and get more pregnant mothers who may be smoking to stop smoking and get involved in taking cessation courses. We offer vouchers and coupons for them to complete courses and to enroll in these classes. And there's a couple other different projects that I'm involved on, but I'm very excited about this new position that I'm in because I feel like it's the perfect foundation for me to continue to grow in my career, but also I have so many ideas about how to make this program expand and become bigger.
That's great. That's a great vantage point. Also, you working with the youth and now working with everybody, but also priority populations, because you have that linkage of not just for adults, but sometimes that mindset of how they started, why it's important to them, why they're seeking it, those social pressures and things of that nature from the beginning. That's valuable. Right. Critical work too. So thank you for your service of what you're doing for the state and beyond, Ladarius.
Yes, sir.
And that makes me want to ask you this question. For people who may not understand the gravity of the situation we're dealing with when we talk about tobacco use, what are some of your insights or observations you've made in working for youth for so long in this particular area of tobacco usage?
I think that we really have to pay attention to the facts, and we really have to do our own research. And I think young people need to know the truth, because even the fact, let me slow myself down. I mentioned earlier that I did a master's project on hookah and e-cigarettes, so when I was in undergrad, hookah was popular. Everybody did it. I went to a couple of my friends' house. They had a hookah set up, it just was a popular thing. But then when I got into doing this research project and I realized like how potentially dangerous it was, it's like, man, that's what everybody's been raving about since high school and in college and things of that nature. So it's very eye-opening. So what I would tell young people, youth and young adults, anybody interested in trying some of these products that's out here, what's the old saying? Everything that glitters isn't gold. Do your research, man. For real, do your research. And as you do your research, accept the truth. I think, and value your life. I think sometimes, especially right now and what's going on right now, a lot of people say, oh, this is killing me anyway. No, that's the wrong mindset. Value your life, don't leave here early, enjoy life and put down some of these toxins and, start treating your body and your health better. Because when we get in them hospitals and the doctor's telling us like, hey, it's either this or that, it's real. It's real, especially right now,
Real,
what's going on in
real.
with e-cigarettes. And I'm not trying to skip too far ahead in the conversation, but since you got me started on it,
No, please go ahead. Yeah, please.
I get asked all the time because everybody knows I work for Tobacco Free Florida. People are looking at me, they're like, hey, with the e-cigarettes, are they more dangerous? Is this bad for me? Things of that nature. And I tell them, I say, there's nothing out there, that's a foolproof fact saying that's more dangerous. But if you look at everything that's going on around you, use your eyes and use your sense. When these products first came out, it's all a test. When these products first came out, they were an issue. Why? Does everybody remember? They were exploding in people's pockets. They were exploding in people's hands. People are using them. They were exploding in people's mouths. That showed you right there. They did not get the defects out of the way. Right? Now, a couple years later, what's happening? We're seeing people that vape saying that they had to get a lung taken out. Young people, 17, 20, 21, you know what I'm saying? You got parents up here on the news talking about how this vaping device ruined their child's life. It's all this different stuff that's been around the news for the last couple of years, but people are not paying attention to it because everybody's caught up in the rave, everybody's caught up in the trend. So that's why I have to reinforce what I just said a minute ago. Do the facts, do the research. Nothing should be going in your lungs except clean air. Period.
And like you said, it's fine if we hop around a little bit. Takuma will get us back on track. He's masterful, as you already know, with the pre-work, pre-interview work. But I do want to talk a little bit about, back to your point about hookah and e-cigarettes and things of that nature. I was having a discussion, recently about this related to tobacco use in Black men and nicotine and menthols and all kind of things. And one of the things that I referenced is with cigarettes, there's been a lot of work done to kind of create isolation, right, for cigarettes, right? Like if you want to smoke, you really got to want to smoke. I mean,
Yeah.
I'm in Florida, right? It's hot, but Takuma's in Chicago. If it's cold, right, you can't smoke, you can't light a cigarette in a building. So if you want to smoke, like, you got to really want to smoke there, right? Because there's isolation, like putting you on an island, like you have to go outside in the cold to smoke that. And the thing about the whether that be hookah, right, where you kind of building community, right, and the e-cigarettes is, especially the e-cigarettes, I mean, it's like the vaping and things of that nature, it's elegant, it's discreet, right?
Right.
I see somebody in a restaurant and somebody finished their meal and they get up and take a quick hit and move on. They're not standing outside in the cold, Takuma, because it's Chicago. They're in the middle of the restaurant. It's elegant, it's sleek, it's discreet. There's not that kind of social pressure of like, what are you doing? You know, smoking, trying to smoke on a plane, or trying to smoke in the airport, or trying to smoke in the room, and I'm sure that that is creating more challenges for, again, you know, trying to have people stop or not, you know, take part of that. With cigarettes, it's not that it has been easy. It took a long time to get there, but at least
Right.
the world is kind of creating social pressure and putting people on the island like this. You know, I don't want that in my clothes. I don't want that in my house. I don't want that around the baby. But vaping and other things seem to be, you know, less of that related to discretion and being able to kind of, you know, maneuver and navigate. And I'm sure that's harder to combat.
It, I guess it is, but you know, at the same time, like, you know, what I just said, people gotta learn the facts. I think the reason why vaping gets away with what it gets away with is because not too many people are doing the research, what's going on. So um, like you said, it is discreet. Like, you know, people can do whatever they want to do. Like, one of the biggest issues I think for the longest, for the last 2 or 3 years, was trying to figure out every device that was a vape device, because at some point the industry started creating devices that look like a USB device, or look like a regular pen like that you could write with, or look like a game board that people play games with. So, you know, like, of course, with those type of gadgets looking like that, there was going to be an increase in usage among young people and whatnot. And then with all these crazy different flavors coming out, it makes you go want to taste it. Like, you know, just think about any Fanta drink or any soda that, you know, flavor that you really like, or any candy that you like, and you got over 1,000 different flavors out there. Of course, people are going to let it go. Like, it looks harmless. It doesn't make a smell, whatnot. But what we have to consider is a couple different things, Johnny. You brought up a very good point about it took a very long time for cigarettes to get regulated to the point at which it is now. Cigarettes been around for a long time, and you know, if we do the history, they've been around for a very long time. And what the first Surgeon General's report that really brought it up that cigarettes might be the issue for young people was back in 1964, I believe, if my facts are correct. And then even now, look at the point where we are. We're in 2022, and now 60 years later, it's like, okay, if you really want a cigarette, you have to go that far out. So think about all that time that has passed and how many lives were affected before people started to really realize the damages that cigarettes cause. Now, if you want to take that same retrospective study and apply it to what's going on right now with e-cigarettes and vaping devices, how long is it going to take for people to start to realize, hey, just because it looks discreet doesn't mean we need to let people do it right next to us? Because
Absolutely.
one of the biggest issues of cigarettes is the secondhand and third-hand smoke, right? So
Absolutely. Absolutely.
when we begin to look at these vaping devices, are we then going to apply the same theory towards it about secondhand and third-hand vape? Because what we recognize about cigarettes is the byproduct that comes from the secondhand smoke is often more toxic to the party that's being affected by that secondhand smoke than it is the person that's actually using it. So when are we going to apply the theory to vaping? That's the question.
That's right. People having life altering illnesses, and they're not even the smoker, right?
Mhm.
Like you said, just somebody, you know, around a loved one or significant other that is a smoker. So yeah, you're right. That's wild.
And for me, it begs this question, because what do you say to somebody who's like, look, I'm not vaping, I'm not, smoking Newport, a pack of Newports a day. I'm just going to the hookah bar, I'm chilling with my friends, I take a toke or two. How is that possibly going to harm me? Can you talk about some of those risks that are associated with even doing hookah?
Absolutely, sir. Well, it's been a minute since I looked at my hookah facts. I've been battling a different enemy in the same family. But last time I checked, an hour of smoking hookah is between 100 to 200 cigarettes, unless the numbers have changed. So when you're sitting up there
Wow.
listen, we finna dive into hookah for a second. Listen, let's dive into hookah.
Whew.
So you're sitting there puffing it with your friends, and y'all passing the pipe around. You know, inhaling that because it's come through a tube. It's not just a little small combustible device. That's between 100 to 200 cigarettes per hour. So let's think about how long people go there.
Volume.
People go
Volume.
there
Wow.
for, my friends back in the day used to go there for 3 to 4 hours. So think about that. So that's between what, 400 to 800 cigarettes that they've been there, right? Then what you also have to consider is if you're just sitting around, well, Takuma, Ladarius, John, I'm not really puffing it like that. You're in an atmosphere where other people are puffing it. So you're inhaling all of their secondhand hookah and stuff like that. I don't want to go too deep because I don't want to scare people too
Go.
harshly.
No. Scare them. Go. Go. Talk about it.
I mean, come on, man. Like, do you know for sure that they clean the hookah? In the past,
Exactly.
I've heard
That
people in the past, I don't know if they updated the FDA deeming rule, but when it first came out, it has said that there was nothing about cleaning the hookahs in there. So the joke that we used to make when we used to present on hookah is, why did you order strawberry, but your flavor tastes like green apple? Because the person before you had green apple. There's been a couple of studies where they actually cleaned hookahs out. And when they cleaned the hookahs out, they found like all types of stuff inside the pipes and tubes and whatnot. And so, like you have to consider all these different risks. And then I think some people, there might be cases of mono spreading because everybody's mouth is on that. So like, you have to really be sure that I really encourage people to know the facts and really protect themselves, because don't just get caught up in the hype. And that's what I'm saying about e-cigarettes. The same hype that went on about hookah and cigarettes, it's the same hype that's promoting e-cigarettes and vaping devices now. So when they tell me, man, I'm just going there, I'm just enjoying myself. Okay. And do you leave feeling dizzy? Do you leave feeling lightheaded? If so, that means you possibly got some contact. And if you got contact and you've been there for a couple of hours, what's the number they said? 100 cigarettes or 200 cigarettes makes you qualified as a lifetime smoker. So if you just been sitting there getting contact, think about how many quote unquote cigarettes you inhaled, and now you just left after one trip to the hookah bar and you're a lifetime smoker. Deemed.
Wow. With something on your mouth, potentially from your folks. just because they're my friend don't mean I want to be having my mouth behind somebody else who knows where they had their mouth. Wow, that's powerful.
And add another point on that, we're still in the middle of COVID. So think about everybody that's been doing hookah in the middle of COVID, and then they've been wondering, how did I get COVID?
Yeah.
Okay, first of all, my mind is blown right now.
Takuma, you stepped through the hookah bar and you coming out as a lifetime smoker.
Right.
Statistically, right? I mean,
statistically.
Yikes. Well, and it naturally begs the other question, right? There's this perception that e-cigarettes aren't as harmful. It's a vapor. It's not the traditional smoke you're getting from a cigarette. Mm-hmm. Can you talk about, is that true that it's less harmful, or is that not true? Can you talk about that a little bit?
I don't have any really, I can neither say it's less harmful or more harmful. All I can tell you is the potential damages and harm that it can cause. And some people will say, oh, well, there's no nicotine in this. Now, my analogy to people when they say there's no nicotine in this e-juice that they're vaping is that e-juice, or e-cigarette, let's think about a soda. Sodas are not healthy for us anyway. But all you're telling me is if you don't have any nicotine, is that your soda has zero sugar, because the nicotine is the addictive nature. The addictive part of the flavor of that e-juice or whatnot. That e-juice still might possibly contain heavy nickel, heavy metal, heavy different things that should not be going into your lungs. And think about it. Vapor is water steamed up. Vapor does not have no flavor. So you're trying to tell me that you're inhaling flavored water? I think not. I advise people to do more research on that. And just like I had kind of referenced a little bit earlier, look at all the damages it's causing to people. You literally have people who said that they were a Advent vapor now going against the vaping industry. You got people going around telling everybody like, hey, don't be like me. I used to avoid the information. I used to tell my friends, buzz off. I'm gonna get this nicotine buzz. I'm gonna go Juul. I'm gonna go, Soren. These different names of these products. I'm gonna go do this. I'm gonna make videos blowing vapor into the screen and do tricks and this and that. And now look at these people. Some of these people, are at risk of different illnesses, because one thing that we have to be concerned about is COVID-19. At one point, people were calling it a respiratory illness. So who you think is more at risk? The people with the weaker respiratory health. And who has weaker respiratory health? People who smoke and vape. Because why? Because your lungs are always battling for fresh air because of the habit that you're participating in.
Yowza. You said heavy metal, heavy nickel.
Heavy metal, nickel.
I mean, I've heard that about, potential shards of metal going into your respiratories. Oof.
And what we have to consider is the fact that when you light a cigarette, you hit it with the lighter and then you pull the lighter off. So the heat source is gone, which is the lighter. But with these vaping devices, they have circuitry, they have heating coils within them, they have all types of different things within them. So what's not to say that some of that heating coil is tipping off into what's being inhaled. What's to say, and then with that heating coil within the product, it's able to heat the particles up more, where they're able to go deeper within the lungs than a normal cigarette would.
Wow. Wow. So, it's a good conversation when you look down, it's like, oh my God, we have less than 20 minutes left.
Keep it moving. Keep it moving.
We're going to keep it moving. But, this came up in a meeting we had this week about the intentionality that Big Tobacco has operated with in terms of marketing to the Black community about tobacco use. This is something that's gone on for years. We did reference one cigarette company that had a slogan and they had posters and advertisements up back in the days, in the 80s and 90s and what have you. Can you talk a little bit about that intentionality that Big Tobacco has operated with in terms of marketing tobacco usage in the Black community?
I actually, the National Conference on Tobacco and Health was a couple weeks ago in New Orleans, about 2 weeks ago. I knew already quite a bit about Big Tobacco schemes towards minority communities, Black and brown communities and whatnot. But I just found out a little bit more as I went to New Orleans. I sat around at some different roundtables. There was a CDC meeting. There was the National Youth Coordinator Camp meeting, all types of different things. I've heard so many stories and testimonials over the weekend. Let me just familiarize you with a few. I actually heard from some people back in the day how tobacco companies used to come into Black and brown communities and give out free cigarettes, give out free packs, give out, like they people were waiting on these cigarette companies to come through and give stuff out. I've heard all types of different stuff. I heard how, back when the war was over, Vietnam, I believe, it was kind of routine. Like we saw soldiers with cigarettes. We look at all the war movies, they're out there smoking a cigarette. But then the truth has came out about Big Tobacco, that Big Tobacco then said, okay, well, we don't want to be seen as a company that just goes after soldiers. Let's show that we have no discrimination towards any community. So then they start to heavily market their product towards African-American communities. And what we began to see then was, all these posters with, African-American faces on it, making it look cool to smoke. I think there's actually a brand of cigarettes called Cool. And, but then even if you don't want to believe those facts that I just named alone to you, when you go to an African American community, take a look at all the convenience stores windows, take a look at the parking lots at the pumps, look at all these advertisements. And a fact came out a couple years ago that cigarettes are promoted, tobacco is promoted 9 times more in minority Black and brown communities than it is in other communities. And myself, I heard that fact and I started riding around my town. And it kind of shocked me at first, I'm like, hey, when I go to this side of town where, I would say more wealthier families live, I don't see no tobacco advertisements in the windows. I don't see none of that. But then when I come to a certain part of town, where low income may reside and more Black people and brown people that resemble my hue and distinction, I see a lot of tobacco advertisements. I actually see cigarette butts everywhere. I see cigarette butts by schools. I see cigarette butts by daycares. I see cigarette butts in playgrounds, dip cans and playgrounds, all types of different things. So even then, we have to take a look and realize advertisements go beyond just a poster. It goes to the cigarello packages laying on the ground. It goes so deep. And and we see it a lot more in the Black community. The reason why is because they have preyed on us. When they realize that we love menthol cigarettes, when they realize that we love that menthol flavor, they begin to push it on us. And just like anything, if you put an image in front of somebody, just like when you're going shopping in the store, they put suggestive marketing in front of you for so long, you're going to say, hey, why don't I just pick this up? Why don't I just try it?
Yeah, I understand that the numbers are just shocking related to, African American community, related to other communities. And as I was talking to Takuma and the team about this, the sinister part about that a lot of people never talk about is some of the advertising agencies and marketing folks that were helping push that message were in the African American community, right? They were using that lens and that discussion to push that message to the African American community. So they were profiting, which I understand, right? I mean, if you have an advertising agency, a marketing agency, that's your business, but that's a huge account for a big tobacco to get a tobacco account. So they were profiting and doing well for themselves, while unfortunately, really doing harm for generations in the community.
All right. No comment on those people. Hey.
But hey, Takuma, I was about to say that's a whole nother discussion. If somebody gets a big account and it's McDonald's or something of that nature, I can't hate them for having a McDonald's account. That's some great money, and they're doing job creation and
right.
Wealth for people. But at the same time, again, you're potentially harming if you don't, if you're not creating or promoting balance also. So that's unfortunate. But you're right, that imagery, that messaging, that lifestyle, in the sense of being cool and showing wealth and progression and all of that has been around for a long time, which makes it uncles and dads and mothers and things of that nature that do it. Another thing, when you talk about it, I have also heard stories about different areas, especially up north, where there were actually like vans that would come by and be handing out samples. And we even talked to somebody recently where that's how they began smoking, is from a sample. They started from a sample. So something free, they kind of started them on that path. Now, don't get me wrong, everything they're looking at around them is also helping encourage and encourage this behavior. But the fact that physically in their hand, they got a sample, that was the beginning of it. And another part of that discussion was when you talk about Ladarius, the communities. Yeah. you go to a certain part of town, an affluent part of town, and you go to buy a pack of cigarettes, it's going to be a full solid pack of cigarettes, and that's going to be expensive, right?
Yes.
If you go to other parts of town, especially again, if you're up north, New York City or something of that nature, different parts of New York and bodegas and things of that nature, and you want to get a Lucy, a couple of Lucy's and things of that nature, you can get them, right? In certain parts of communities, you can get Lucy's, and that, you go up there and try to buy, or go to a certain part of town and try to get a Lucy. They're like, what are you talking about? Like,
Exactly.
I'll sell you this pack of cigarettes. So
Yes.
for people to be able to gain access to cigarettes in small quantities, that's things that happen in in certain parts of communities, which is again damaging, creating easier access to it.
Yeah, and I mean, and even where I just want to expound on something that you just said a second ago. Like, just think about that. I'm getting something free. I'm getting something free. And then, like, let's also look at more tobacco advertising tactics. It's not just the advertising, it's the coupons, it's the rewards clubs. Just like we get, I got to tap myself on the wrist. I'm a part of Ralph Lauren rewards club. So when I see the polo, man, 30% off, 50% off at the outlet, I used to run out there. I don't do it no more. I got financial goals now, a little bit financially more literate now. But what I'm saying is, it makes you feel a part of a club. They try to make you feel a part of a team. They try to make you feel like you're a prized customer. And, just exactly. Just like when you go hop in the chair on your barber chair, you just don't go in there for the haircut. You go there for the service, the conversation. So once they hook people into feeling like you are appreciated, then it's like, their eyes become kind of blind and numb to the fact that you're buying an addictive product that's possibly killing you.
Wow. We have 10 minutes left, which is crazy. It's just gone by. I'm like, I can't believe it. But, we also we like to talk about solutions and kind of getting into, or what does the health equity aspect of this tobacco conversation looks like, especially when you talk about public health. What do you think will work to reverse this trend of tobacco usage, especially in Black and Brown communities, from your vantage point?
I think what's going to stop it is when we all get on the same page. If we look at anything in history, period, or if we look at any behavioral health model, I gotta go back to my public health background. If we look at any behavioral health model, behavior changes when attitude changes, when intention to behavior, perception towards behaviors changes. So when we start to accept the facts and accept the truth and, start to want better for ourselves, then we'll start to do better for ourselves. But it begins with all of us, we got to put the facts out there. One thing I love about SWAT, even though it's students working against tobacco, one of the things within the mission and within the vision of SWAT is not to preach to people who are smoking or not to judge people who are smoking or vaping. People have fallen victim to the tobacco industry, and that's the truth. So, we need to, we don't need to preach to smokers. We need to educate them. We need to raise awareness. I feel like, by raising awareness and providing that education and providing those outlets and providing people with those resources and different mechanisms, it'll make it a lot easier along the way when people have to make the choice about getting off of it. Just to tell you a quick story about why I'm so passionate about this, I think it ties in, is just like I mentioned earlier, my grandmother used to smoke. She used to smoke cigarettes nonstop. Till she got to the doctor, and the doctor told her one day, hey, it's either the cigarettes or your life. She went cold turkey. My father used to smoke. He stopped smoking. And, all types of stuff. I've seen and heard people. My grandfather, he stopped smoking for 20 years and still ended up dying from lung cancer. That tobacco caught back up and killed him. So, I'm really serious about this when I tell people to learn the facts. Everybody, life is their own responsibility. It's their own choice. I don't judge nobody. But if you want to have the conversation about the information that's out there, we're going to have the conversation. And then it's up to you to make that decision. Whether you make that decision right there at that moment or later on, I still support you. And I hope the people that's providing you with the same type of information that I am providing you with support you in that same manner. To quit.
what advice would you have for someone who may be thinking about quitting, smoking or vaping? What have you seen in your line of work, in your experience? What have you seen work in terms of people putting it down and not smoking at all?
I think, it might sound funny. The same message that worked for people putting on a mask during COVID, um, is similarly the same message that works for people quitting smoking and vaping. When you think about how it affects the people you love, how smoking might affect the people you love, you'll quit smoking. When you think about the idea that, man, if I don't put this thing down, I might not see my son grow up, you'll put it down. When you think about, man, I want to be around to see my grandchildren get married or my great grandchildren walking and crawling and things of that nature, you'll stop smoking. When you start to see how much smoking and vaping is reducing your life, you'll begin to quit.
So what are some of the resources available? Like Takuma said, somebody realizes that, Ladarius, right? They want to take certain steps. They need to take certain steps, but obviously it is quite challenging to do that. What are some of the resources available to assist somebody along their journey to quitting?
Right. Well, if this message is hitting somebody outside of Florida, I would suggest they Google a couple of different things, find different local tobacco control programs within their state or within their community, because if they get in contact with the local tobacco programs within their state or community, they might be able to get in contact with somebody that can refer them to cessation services, and they can find out about the information that's out there. And when just take that step to learn about how much tobacco is really impacting your life. Learn about how many years tobacco usage can reduce your life. Learn about how much money tobacco is taking from your money on your pocket. If you're a pack a day smoker, a half a day pack a day smoker, we have different materials to show that calculator, the price calculator. And even right now during this time, think about how much tobacco is taken away from your gas money or your groceries. So I advise people get in contact with their local tobacco programs in their communities and whatnot. But if you're here in the state of Florida, I advise you to go to the tobaccofreeflorida.com website, look at our cessation services or cessation access links, and take a look and see how you can quit your way, or find somewhere where you can attend a class, a web coach, or get texts or online messages that can help you have a tobacco-free life and a better future.
Takuma, we touched on menthols a little bit, but we didn't really dive heavy into it. I know, again, you've researched and written some things, and could you talk a little bit about that, Ladarius, in the sense of just menthol usage, and again, specifically, obviously, we're talking about the African American community, Black men, but obviously, it's having a very damaging effect on on the larger population, and obviously affecting African Americans at a greater rate
Right.
because of usage. Could you talk a little bit about that, and also some of the things that are happening in the world to potentially combat that?
Right. Well, to touch on menthol, like as we kind of mentioned a couple times here, menthol was identified as the flavor that most African Americans buy within cigarettes. So, it became a heavy issue because once it was recognized, of course, any producer is going to continue to push out their best product. Now, when African Americans use that product, the issue about it is we're already at a disadvantage because sometimes we're pre-diabetic, have diabetes, hypertension, and all types of different pre-existing conditions. So using tobacco only further worsens those conditions. Lately, I think that they're pushing different bills and pushing different policies to eliminate menthols, and there's a big push and a big wave for that right now. So potentially, we can see lives being changed. We can see a decrease in the national medical bill because less people smoking, better health in the state of in the country United States. So these are the different impacts that we could potentially see with a menthol ban.
And not just some of the things we talked about, the target marketing, accessing communities, but also, I mean, just, you know, physically in the sense of, like you said, the flavor, the less harsh, you know, experience, right? The smoother, that, you know, all of those things in the sense of inhaling it and it feeling kind of almost like vapor on your, all of that, all of those things have helped, you know, create an experience where it's like, oh, this is a better experience than not.
Yes. Yeah. I'm sorry. I forgot to touch on that point. Yeah. You know, menthol, they say because I don't know from experience, they say that it causes a cooling sensation within the chest. It makes people feel like it calms them down. Some people say they still smoke because it relaxes them and whatnot. All it does is just ease the damage that's causing to your body. It makes you feel that sensation, but like, you know, under the veil, under the rug, is still doing some damage.
Very, very much damage. Yeah.
Say this about all our guests, but we got to have you back because I think there's
we got more to talk about.
We got more to talk about. There's this conversation I think we need to have too about just you know, the comorbidities, right? You alluded to it, the tobacco usage with the hypertension and the diabetes, and also the mental health component about it, about, you know, if we're living exposed to a stressful environment, how cigarettes can create this illusion of calm. So there's a lot to get at. There's probably 3 or 4 programs that we could
Listen.
do.
Listen, I'm all here for it, man. I'm ready to talk about tobacco. This is what I do, man. This is what I love. I actually go around. That's why you kind of flattered me earlier, sir. You humbled me when you said you heard me speak before, because this is what I love to do. I love going around educating people. Like I told you earlier before, when I found myself learning about hookah and the damages that it does, when I found myself learning about public health and the issues that we are blind to, I felt like it was my mission and my purpose to let people know. So please, I'm all here if you need me.
And thank you so much for being an ambassador for the youth. I mean, I would love to have more of that discussion. Again, just, you know, making sure young people have access to information and understand it's not all about, as you said earlier, following trends and trying to be cool. I mean, you could be doing some major damage to your to yourself and your future. So yeah, thank you for being an ambassador for the youth.
Oh yeah, and my light finally went off.
All good, right on time.
Yes, sir.
Wow. Yeah, you know, thank you so much, Ladarius, for taking the time to chat with us today at Black Men's Health. Is there any contact information if people want to reach out to you and get more information? Is there any information you'd like to share?
Well, I tell people personally, you can follow me at the_LG_experience. I put up motivational information on there as well. Like you can find some of my quotes, you can find some of my videos of me talking. If you want to get in contact with me, you may feel free to reach out to me at ladarius.gamage@flhealth.gov for more information. But still, I tell people, you know, Google, learn the facts wherever you are. And if you're here in Florida, please go to tobaccofreeflorida.com and learn the information there.
And we thank you so much for spending time with us today and sharing the knowledge. And like Takuma said, we'll be sure to have you back in the fold to have some continued discussions about this, Ladarius. Grateful, brother.
Yes, sir. Thank you so much.
Absolutely.
Big shout out to our colleague Nadia Perry too for connecting us. So we're grateful for that, man.
Absolutely. Thank you, Nadia, so much for this opportunity.
All right. Thank you, Ladarius. We appreciate you, brother.
Yes, sir. Take care.
You too. Respect.